Welcome to Rapid ECG Learning with Medfoxes. In this video, we are diving into an essential concept in ECG interpretation, the cardiac axis. Understanding the cardiac axis is a critical step in analyzing the heart electrical activity, and it can provide valuable insights into underlying cardiac conditions. Whether you are a medical student, healthcare professional, or just curious about ECGs, this video will break down the topic in simple, practical way. So let's get started. The cardiac axis refers to the overall direction of electrical depolarization in the heart, usually seen in the frontal plane. It is a crucial measure, helping us to understand how the heart electrical impulses are moving and what they may reveal about potential heart conditions. Let's begin with the normal cardiac axis. The normal range is generally between 30 degrees to plus 90 degrees. This means the electrical impulse travels from the upper right to the lower left of the body. On a 12-lead ECG, a normal axis typically shows positive QRS complex in lead 1 and lead AVF. Next, let's discuss left axis deviation or LAD. This occurs when the axis is between minus 30 degrees to minus 90 degrees. Left axis deviation can indicate conditions such as left ventricular hypertrophy, left bundle branch block, or other conduction disturbances. On an ECG, left axis deviation is identified by a positive QRS in lead 1 and negative QRS in lead AVF. Moving on, we have right axis deviation or RAD. This occurs when the axis lies between plus 90 degrees to plus 180 degrees. Right axis deviation can suggest conditions such as right ventricular hypertrophy, chronic obstructive pulmonary disease, or a pulmonary embolism. On an ECG, you typically see a negative QRS in lead 1 and a positive QRS in lead AVF. Lastly, we have extreme axis deviation, also known as northwest axis or indeterminate axis. This occurs when the axis falls between minus 90 degrees to plus or minus 180 degrees, which is rare. It usually indicates severe underlying heart condition or abnormal electrical conduction pattern. On an ECG, both lead 1 and AVF will show negative QRS complex. This brings us to the end of part 1, where we introduced the basics of the cardiac axis and how to interpret it using lead 1 and AVF. In part 2, we will continue from where we left off and dive deeper into practical techniques, including the Quadrant Method with clear ECG examples to help you master cardiac axis interpretations. Don't forget to watch part 2, link in the description or on the screen now, and if you are enjoying this series, hit the like button. Subscribe to Rapid ECG Learning with Medfoxes and stay tuned for more ECG insights.